How long is it non-infectious? Yeah, so you've got a stall or you've had an infectious horse. Well, if it's influenza, it's probably a day or two. If it's Clostridium difficile, it's probably going to be still alive when I'm dead. Some things can live for decades. If it's going to be, most of the viruses we deal with are going to be days. They can survive in the low end of that. Some of the bacteria, strangles, the strep E. coli bacteria, if it's in the sun, it'll die within a day. If it's in kind of a nice indoor environment with no UV exposure, a couple weeks probably. So it's really hard to say. It depends on what the bug is. In general, if I'm worried about some of the environment where I'm going to say, let's rest the stall for a couple of weeks, I'm going to say, well, let's disinfect it, because resting it really doesn't do a whole lot for most of our bugs. But a couple of weeks will get you beyond a lot of those bacteria. Cat poop in a stall. Well, I guess feces of any sort is biohazardous to a degree. It's not going to be a huge concern, I guess, in most situations. Yeah, I guess there's certain things we do have some disease concerns with cat poop, so it's ideal to keep it out. It's not something where I'm going to say if you find cat feces in the stall once, you should go shoot all the barn cats. Again, yeah, well then that's something we're probably trying to figure out how to prevent. That would be good. Like it's pretty low risk, but if there's it's one of these things. If you can do something that's not kind of draconian or inhumane for the cats and practical, then I would try to reduce that. But it's especially in the absence of any recognized problems from it, I'm probably not going to pay too much attention. There's some things, some theoretical concerns, potential concerns, but nothing probably major around here. How long? Well, if it's in kind of a dry lot, it's going to be there for a long time. In wood, not sure about wood. I'm not sure anyone's really looked at in wood. Probably it's going to live for a reasonable period of time, though. It's a bug that can survive in the environment for a while. It likes kind of the dirty environments, like soil, sand lots, and things like that. Once you've got rhodococcus on a farm, you've got rhodococcus on a farm. Like it's getting in the soil and it's going to be there. But in a stall, we tend not to be very aggressive with isolation and aggressive cleaning and disinfection with rhodococcus, because if you've got it in the horse, you've probably got it in the broader environment. And the risk zone, the risk for rhodococcus exposure is really young, so it's kind of that really early window of life that we're worried about. So we don't pay as much attention to disinfecting it. There's still a lot of things we don't know about rhodococcus. It's the young foals. It's that really early foal age that's susceptible to get infected and get disease. And the question is, how much circulation is there amongst other horses? Does your average gelding pick it up and poop it out and spread it around? We don't know as much about that. We certainly know that there can be carriers that can contaminate the farm. We pay a lot of attention to the foals. I think there are probably a lot of questions on that still. Yeah, what can event organizers do? It's a great question. It's part what can they do and what will they do. It's often more of a question of what will they do. So the biggest thing, again, is that syndromic surveillance. So what are some things that would indicate a horse coming into an event or a sale is infectious? Well, fever, cough, runny nose, diarrhea, those things can be flagged. And something like getting a temperature is very easy on a horse for most horses, right? Especially horses going to a show. If you can mandate, has to have a temperature taken. Yeah, it takes a little bit of time, but temperature has to be normal, okay? And if it's high, here's what we're gonna do. Well, we're gonna have you park your trailer over here. You can stay there for a couple hours. We'll take the temperature later, because you can say, okay, maybe it's stressed and hot from shipping, but if it doesn't come down, it's not, there's something going on there. And if that's the case, off you go, and we'll reimburse your admission fees. And no one likes to do that, because they want the horses there, and they want people yelling at them. But that type of syndromic surveillance can really reduce the risk. And for me, the argument I have, well, discussion I have is, yeah, you're gonna take some abuse over that, but you can also position yourself as we're doing everything we can do so that you don't bring that strangles horse back, or you don't get that influenza outbreak. Now, some places, especially in the US, have started mandating equine flu vaccination, proof of vaccination within a defined period before the show following outbreaks. And it's been rather controversial, but places that have had outbreaks are doing that, and they're putting up with it. But I think the syndromic surveillance to prevent those high risk, kind of overtly shedding horses there. And then a lot of it's just facilitating, letting people do good infection control. So if they've got enough space that people can spread out a little bit, you don't have to have all the trailers there and all the horses tied up together. You've got facilities for people to wash things up properly. Maybe they give out hand sanitizers. Maybe they do some really common sense things. They've got people that are coming around checking the horses, any officials that have a hand sanitizer with them, so they're able to look at one horse. As you're walking the next one, you can disinfect your hands. It's all those really basic things that you can do. That's all you just need is give people a little bit of assistance, and you can probably improve that on-show infection control. Foot baths and foot mats. Okay, I'm not a big fan of them for a couple reasons. So, as everyone knows what foot baths, foot mats are, you've seen them. Some of them are these mats where you put disinfectant on and they're kind of soft and spongy and you step on, they foam up around there. Others are just a bucket and you put some disinfectant in there. Now, we know they can kill things on your boots. So if I've got salmonella on my boots and I go step in a foot bath and it's an appropriate foot bath and I'm there long enough, it's going to kill it. Now the question is, does it really help us on farms? For me, I guess that's going to be a really high-risk situation. I'm going to consider using it or in an outbreak. Now, the problem with foot baths and foot mats, well, there are various problems. One is people tend to do like this and step over top of them as opposed to step in them. It's amazing what people will do. So if you don't use them, it doesn't work. The other thing is the disinfectants. Bleach is used a lot. Bleach is a great disinfectant, but bleach gets inactivated by light and gets inactivated by dirt and poop and everything else like that. And what do we have in our feet in a barn? We've got dirt and poop and things like that. So if you see a bleached foot bath that looks like soup, it's probably poop soup. It's probably not actually any actual bleach doing anything. So if you have a foot bath that's bleached and it's changed regularly and people have relatively clean footwear going in, yeah, it's probably going to help. If people are stepping in after they've stepped in a big pile of manure, it's probably not going to do a whole lot. In some ways, I think they can be useful in that they raise some awareness. So if you've got a concern going on, you've got a high-risk case, or you've got a quarantine animal, and you've got the foot bath there, okay, that's a clue that that's a little different than normal. So there's something going on with this animal, so maybe I'm not going to touch it, or I'm going to find out what's going on, or there's something else going on here. It just raises that level of awareness that can be useful. But as a routine tool, I wouldn't use it as a routine tool. I'm not a fan of high-risk places using it outside of outbreaks. I think people will maybe focus on the foot bath and not do hand washing or other things. So would never say don't use it. I would say don't overestimate how well it works. And if you're going to use them, you need to use them right, which means using a proper disinfectant, proper concentration, changing it regularly, making sure they're clean, making sure people are using it, making sure there's not a slippery area. If you've got it on concrete and you've got a foot bath where you step in and step out and it gets wet, if that's kind of a slick surface that a horse or a person is going to slip on, that can be a problem. There are a whole range of things to think about with it. So I lean towards not using foot baths in most situations, almost all situations.